friends. Today we will be discussing about immunodeficiency disorders. So I will not be elaborately saying each and every point. Okay, so I will be focusing on only the important points and which have been asked in the previous year questions. So I will be focusing only on the most important points and the important topics under the immunodeficiency disorders. So first, under T cell defect, the most commonly asked question is, it is about Digeorge syndrome or DiGeorge syndrome, whatever. Okay, so you can remember it easily like, so it is a Digeorge. Okay, so I'll be saying some of the mnemonics also. And Digeorge, it is nothing but di, di or by, it is like a 2, right? So always remember, and this Digeorge syndrome, everything will be coming under the number 2. Okay, so first see, you can the chromosomal defect here is 22q11.2. okay, something, so 2, everything will be 2. So first point. And second, so what is the defect here? It is, there is an absence of development of the 2 pharyngeal pouches, that is 3 and 4. And okay, first 2. Second, 2 glands will be absent, that is a parathyroid gland and the thymus. So because of this, what happens? So no parathermone, right? Because of absence of parathyroid gland, parathyroid hormone is decreased and T lymphocytes also will be decreased. So because of that, what happens? There will be 2 consequences like decrease, that is a tetany, and infections will be occurring. So it is like the flow chart. Because of absence parathyroid gland, decreased parathyroid hormone. Because of that, decreased calcium level, which leads to an tetany. And because of thymus, decreased T lymphocytes will be there, which leads to the infections. So what are the investigations can be done is, again 2 investigations. So one is for hypocalcemia and another you want to look for the thymus shadow. Okay, so this is clear, right? So let's remember 2. Okay, so next there's another mnemonic also, that is a catch-22. This also you can remember. So this is just a overall, like cleft palate, abnormal phases will be there, thymus aplasia, cardiac defect will be there, and hypocalcemia. So catch-22, it is a chromosome defect. Okay, so if they ask Digeorge syndrome, just remember 2 number, that's it, enough. Everything will be 2. Chronic mucocutaneous candidiasis. So from the name you can get first, it is in candidiasis. So it causes a superficial infection of skin, mucous membrane and the nail. So again, it causes endocrinopathies and autoimmune disorder. So again, the treatment is transfer factor therapy and amphotericin. Okay, so I will be focusing only on the important points, and these are the previous questions too. Okay, so next is these are all coming under the T cell deficiency disorders. Okay, so next it is a purine nucleoside phosphorylase deficiency, in which there will be an PNP, that is a purine nucleoside is deficient. Because of that, the guanosine is not converted to hypoxanthine, so the guanosine level get increases, which indirectly affects the T cell synthesis. That leads to the infections and autoimmune disorder. In this, you want to remember this enzyme name. Okay, they have asked in the exam about which mechanism has been affected. Okay, the conversion of hypoxanthine from guanosine. Okay, so this is important. Okay, this will be asked. Coming for combined immunodeficiency disorders. So first we dealt with T cell deficiency, that is Digeorge syndrome, chronic mucocutaneous candidiasis, and PNP deficiency, right? So next, combine this here. There can be either B or T. Okay, so either B cell deficiency or T cell deficiency, whatever can be there. Under this, the most commonly asked questions are, so just remember WAS. So WAS. Okay, so WAS And W, it is in Viscott-Aldrich syndrome. A for ataxia telangiectasia, and S for severe combined immunodeficiency. So here you want to remember so everything, all the diseases comes under X-linked recessive except ataxia telangiectasia. You can remember A. So A, okay. So rest are all XLR. Again, there is another variant. In severe combined immunodeficiency, there is an adenosine deaminase deficiency, that is an ADA, that is also comes under autosomal recessive. You can remember so starts with A, and here AD, adenosine deaminase deficiency, starts with A, so it is an autosomal recessive. Okay. So first, it is in Viscott-Aldrich syndrome. So you can remember waiter or water, whatever it is. Okay. If they asked Viscott, just remember water. Okay. Or waiter, whatever. You can also remember this will be a little odd, but to remember you can use this mnemonic. Whiskey, right? You will be adding water. So just remember water. So W for VASP gene mutation. So I for immunodeficiency. This you can remember or no need. Okay. So just remember water. That is also enough. W for VASP gene mutation, and T for thrombocytopenia, and E for eczema, and R for recurrent infection. Okay. Okay, remember. So if they are asking Viscott, whiskey, water, that's all. So when you're coming for water, again diarrhea, loose stools, that's it. So in Viscott, what are the immunoglobulins usually get elevated is, see, elevated, E, here A. So both IgE and IgA usually gets elevated. Okay. So just remember, and then here there is a specific point. Since there is a thrombocytopenia, just remember small platelets. So decreased, right? So it is somewhat correlating, a decreased platelet or small platelet. So you can remember it easily. And then there is an increased chance of non-Hodgkin lymphoma. So just remember, if they are asking Viscott, so remember whiskey. So you will be adding water, and that whiskey brand is NHL brand. Okay, that's all. Rest are all easy, right? You remember water and elevated. Ataxia telangiectasia. Okay. So what is that? First we dealt with Viscott-Aldrich syndrome. Now ataxia. When you come across the word ataxia, won't remember yes. So defecting ATM gene, it is, I told already, right? So the diseases which coming under this combined immunodeficiency, so everything will be XLR except two. One is ataxia telangiectasia, another it is an ADA of the skid. So next it will be angiomas, that is a spider. Angiomas will be there, and then ataxia. So from the name, that is a cerebellar ataxia, and again here there will be a decreased age. AGE, remember, that's it. And then you want to remember another thing over here, and here the patients are highly sensitive towards an X-ray exposures. So how you can remember is C, X. So X-ray. Okay. So what happens here is, since there is a defect in the T cells protections, what happens is, because of the hypersensitivity, when you are getting exposed, because of this ATM gene, there is an abnormality. We can't repair the DNA damage which is caused by the X-ray exposure. Okay, so what happens is, our body cannot recover the damage caused by X-ray, and which leads to the carcinoma in the future. Okay, so just remember ataxia, A's, and X-rays. Ataxia, though here it's coming for X for X-ray. Okay, so I think it's not a recent question paper, but in the past I think there is an about I think 12 years back, right, there was a question a patient was highly sensitive for X-ray, and they have given he came with the complaints of an ataxia, and since like that. There was some clinical history. Okay. So next comes SCID, that is in severe combined immunodeficiency. So here just you want to by heart everything. Okay, there is no other way. So first, what is the mutation here is, it's a interleukin. The main mutation is in gamma chain. Okay, so this gamma chain is linked to the actions of the cytokines, that is in IL-7 and interleukin 15. What happens is this IL-7 is indirectly linked to the development of the B and the T cells. So what happens, since there is a mutation which leads to decreased productions of the B and the T cells. So what happens here is, in IL-15, which is linked to the natural killer cells development, so because of that, again there is a decreased productions of the NK cells. So just remember here, there's another, I told you previously, there's a variant called ADA deficiency which comes under AR. And then there is a gene called RAG gene, recombinase activating gene, and JAK3 mutations. You don't want to know the details of this, so just remember these are the mutations. So main is gamma chain, which is linked to the cytokines of IL-7 and IL-15, and these are all the names which comes under the SCID. Okay, so severe combined immunodeficiency is, the child will be very sick and there will be failure to thrive, because this is called as what is that, bubble baby syndrome, and these children are more prone for the infections. Okay, so because there is a high chance of survival rate, that is to mortality. Okay, sorry, so there's a low chance of survival rate, sorry, really sorry, and that is a main point over here. So just remember, it is severe combined, so the patient is failure to thrive or he can't survive, that's all. Okay, just remember all. I think it's easy, no? Ataxia, it is an C-cell defect. Okay, so under that, first it is in the Bruton disease. It is called as a Bruton disease or X-linked A-gamma globulinemia or hypogammaglobulinemia. As a name, first it is an X-linked gamma globulinemia or hypo. So what happens here? First, it is in hypo means gamma globin decreased immunoglobulin G, and A gamma, it is an absent immunoglobulin G. That's all. So this IgG antibody, as you know, it is most commonly, it is an opsonine, and which helps in an opsonization procedure. So because of that decreased or absent, which leads to an increased infections, that is the most common, it is a pneumococcal and influenza, and this pneumococcal have been asked in the examination. Okay, the typical history. And then, so since there is a decreased immunoglobulin G, what about other immunoglobulins? It will be a normal. So in this condition, the patient can cope up the infections. Okay, he can tolerate some of the infections. So unlike SCID. Okay, so here this immunoglobulin G, it is usually reduced, whereas IgA will be there, and so that the patient can he can tolerate the infections. So if you coming across the IgA, the main is a giardia, right? So since if there can be a history, okay, because if the patient can't tolerate then giardiasis, or the patient having a severe diarrhea because of giardiasis, is having a low immunity, like that means it can be some other immunodeficiency diseases. But here in this Bruton, the patient can tolerate he can cope up the giardia infection. Okay, so he can pass through that. So here another point is, in this patient, in this child, the live vaccines are usually contraindicated because it can lead to because of the decreased IgG, we can't give for the any live vaccines, which leads to the complications. So since you want to remember Bruton, the stands for B, so everything will be B. It is most commonly seen in the boys. It is a B cell defect, and Bruton tyrosine kinase, it is deficient. So what is the action of this enzyme here? It is a immature B cells will be converted to mature B cells with the help of this Bruton enzyme. So since this enzyme is absent, what happens is this immature B cells cannot be get converted, and so there is no proper antibodies will be produced, and which leads to the infections. So another important point is this infections So the babies will be usually presenting it over 6 months, because for the 6 months the mother's antibodies will be protective for the baby. Phagocytosis. So again I am saying I'm not completely taking all the topics, only the important topics which have been asked in the exam. That is an high yield topics only. Okay. So next. So it is a chronic granulomatous disease. Okay. So how you can remember? Just split the words. Chronic, C. Catalase positive organism infections are most common. Next. NI. So 2N. One is NADP oxidase deficiency, another it is a nitroblue tetrazoline reduction test. Okay, it is done for this disease. Next there will be in granulomas, but the important point here, they are the non-malignant. Okay, so again 2 granulomatous 2s. So just remember like this. If they are asking just chronic granuloma 2, so 2 means XLR can also occur and AR also can occur. Okay, fine. So next. So what's the main pathogenesis over here? It is, and normally what happens is, so hydrogen peroxide will be converted into an oxygen-free radicals by NADP oxidase. So if this enzyme is deficient, what happens? This will be accumulating, and this free radical is responsible for to destroy the microorganism. So once it cannot be destroyed, there will be an infection rate. Okay. Next, it is in Chidiac-Higashi syndrome. So just remember, if they are asking CHS, just remember LMN. Okay, L for list protein mutation. So here there will be an defect in the lysosomal signaling will be there. Okay, so next there will be an absent melanocytes. Because of that, there will be an albinism, and then there will be an CNS manifestations will be there. Okay, so here Chidiac-Higashi syndrome. So Higashi, it's like a giant, like Gashi, like this you can remember. So when you compare to the other name, this is like some giant name. So there will be a giant granules will be there. Whereas in Biscot there will be in small platelets. Whereas in Chidiac it is in giant granules. So Job syndrome. If they are asking Job syndrome, just remember hyper IgE. So E for eosinophil will be elevated, IgE will be elevated, and eczema. So once there is an eczema, always remember staphylococcus. Okay, so there is a staphylococcus, skin abscess will be there, and also pneumococcal. So everything related to staphylococcus. Staphylococcus will be causing and skin abscess and pneumococcal. Okay, that's all. So these are the key points. You must not miss any points or any words from the above session. Okay, because each and every point is important for making a diagnosis or to choose the appropriate answer from the MCQs. Thank you, friends.